everyone. My name is Emily Vigu, and I am currently in my last year in the program. I know I don't know all of you, and I don't recognize everyone's name in the class. I'll be graduating in May in the school counseling program. So, just to introduce myself. Now, for my project, I decided to do Girl Interrupted. I had not seen this movie before. I honestly just went on Google and searched movies with sorry, diagnostic characters, and this movie came up as one of the popular ones, and it looked interesting to me, so I decided to watch Girl Interrupted, and the character that I focused on was Susanna Kazin. Now, Susanna Kaysen plays the role of a young woman, and she ends up in a mental institution for a troubled young woman after a failed suicide attempt. And this was kind of the last straw. So she'd had a lot of other episodes and a lot of other things going on at home and in her counseling sessions. But after this failed suicide attempt, she was admitted into the hospital. Um, her attempt, what she did was she said she had a headache in the end, but what she did was she took 50 aspirin and then she chased the 50 aspirin with a bottle of vodka. Now, obviously, that is not a good idea. So, this got her sent into the hospital. Um, and in the clips that I posted, you're going to see scenes of where her diagnosis is talked about. And throughout this movie, it's really about her coming to understand her diagnosis and what is going on in her life. And both her and her parents really struggle during this time. So this movie is really interesting if you'd like to see the whole thing. But I think that the clips do a good job portraying her diagnosis and where I'm coming from with this presentation. So what I'm going to talk about next is her diagnosis. So, in the movie, she's diagnosed with borderline personality disorder, and after watching the whole movie, obviously, I do agree. And the five criteria um, that I um, described and identified her with, um, I will discuss quickly right now. Um, so, the five diagnostic criteria that I believe that she presents in the movie. The first one is number 4, which is impulsivity in at least 2 areas that are potentially self damaging. Now, for Susanna, she has multiple sexual intercourse with her boyfriend very frequently when he comes to visit. She always finds a way to have this happen. But then she also has a relationship with a security guard who she constantly seduces. She also hooked up with her old English professor, and she also has sexual behaviors with her friend Lisa. So that covers the number 4. Now, the second one is number 5, which is recurrent suicidal behaviors, gestures, or threats, or self mutilizing behavior. Now, as I discussed before, she takes 50 aspirin and then drinks the entire bottle of alcohol. But then another part in the movie, she kept thinking for some reason that she had no bones in her body. So, to prove this to herself, she kept continuously biting down on her hand until it bled and it went all the way to the bone. And then she realized that she does have bone in her body. So, things like that were very concerning. The third diagnostic criteria is number 7, which is the chronic feelings of emptiness. And this just comes up frequently throughout the movie, and you can tell that she starts to have depression like symptoms, and you can just tell by everything that's going on. And it is talked about during her counseling sessions that she has feelings of emptiness. Now, the fourth one is number 8, and it includes inappropriate, intense anger, or difficulty controlling her anger and her emotions. And the one episode that really comes to mind and falls under this directly is that she verbally attacked her nurse, and this came out of the blue. So that's very concerning. But there's also multiple other instances, which I'm sure if you watch the movie, you'll understand where I'm coming from. And then the fifth one, which is the final one that I found to be present in the movie, was number 9. Stress related or paranoid ideations or severe dissociative symptoms. And throughout the film, she has lots of, like, I don't know if you'd call them flashbacks, but she has multiple ideations throughout the film. And these will be shown in the video clips as well. You'll get a glimpse of those. So that is what I have for her diagnosis of borderline personality disorder. Now, in terms of a treatment approach for Susanna, the movie has put her directly into the mental institute hospital, and she spends time there for her treatment, and everything is done in there, and she's not allowed to leave. Um, However, as a counselor in practice now, and what I would do personally now in her situation is I would have hoped that she would have gone into a psychiatric unit in an emergency room and gotten treated for her immediate um, failing her suicide attempt and taking care of that in the hospital setting. But then I would also follow up with outpatient treatment and group therapy along with individual counseling using both cognitive behavioral therapy and DBT therapy. I think that the combination of these would be very helpful for her, and that is what I would do as a counselor now with Susanna. Now, in terms of aims and objectives, my first aim that I listed in my case conceptualization is that Susanna will increase her behavioral skills in order to feel more positive in life and that she can regulate her negative emotions better. So, the objective that I first have falling under that aim is that she will learn one new type of coping skill per week to help her deal with those negative emotions. And I think that that's a great first step for her. And then the second objective under that aim is that I will have her do a daily journal. And when she begins to experience those negative thoughts and emotions, I want her to journal them and write through them so that when we meet or when she's in group, she can discuss them and look back on them. Now, for my second aim, I put that I want her to decrease her frequency of any self damaging behaviors, such as her suicidal behaviors, um, acting out sexually, or any substance abuse. And I just want her to feel healthier, both mentally and physically. So I want her to control her sexual relations and behaviors 100% of the time. So I want her to get to a point where she can realize whether this is the right decision or not, and be able to control that, because that's very important, especially at her age. And then the second objective to go under that aim is that I want her to complete a daily log of any self damaging behaviors, and I want her to decrease this to zero by the end of this therapy program. Now, this is really important because with borderline personality disorder, it's very common, and by having her keep a daily log, I want to be able to discuss this with her and have her really think about it. And by doing a log, I think that will help her decrease the number. And finally, what I wanted to discuss is interventions that I've put in place that I want to do with Susanna. So the first one is that I want her to identify coping skills to help her deal with all these negative emotions that she has. I think that can be really helpful for her. And then also, like I discussed before, creating that journal to enter her negative emotions and her negative thoughts that might be running through her head so we can work through on how to change those thoughts to more positive rather than negative. The third thing I want to do is identifying her urges before she wants to engage in any sexual desires and deciding ultimately if they're appropriate or not, and if what she's doing she should be doing, again, appropriate. And then the final intervention that I chose was to create a daily log, like I discussed before, to chart any of her behaviors. So I think by writing it down, I think that will really help her in thinking if this is something she really should be doing, and hopefully getting those down to zero occurrences is ultimately what I want to happen. So if you get a chance, look through all three of the videos. They're very informational and it will really help you understand her diagnosis and where I'm coming from in my interventions, my aims, my goals, and overall what I want to do to help Susanna become a healthier person mentally and physically. So I hope you enjoyed my presentation and synopsis of Girl Interrupted. And if you get a chance, go ahead and take a watch. If you have any questions, feel free to comment and let me know. All right, thanks. Have a good night.